Zero suicide in healthcare is fundamentally about a person-centred improvement in healthcare, an improvement-based approach, using the same quality management principles that have been used elsewhere in healthcare on issues such as wound management or infection control. Well, evaluation can mean many things. It certainly means data-informed judgments that help us make decisions. Evaluation can help us design programs and tell us how we're going with the implementation of new programs. And evaluation can also help us look at how we can continually improve and monitor the performance of our programs. The planning of the evaluation framework when you're implementing zero suicide is really important right from the start, so that the decisions about what data is collected, what measures are used, and how they will be utilised in the process of implementation and continuous improvement is really important.
I think it's really important to always be striving to improve our services. I didn't have the opportunity initially to provide any feedback on my care through the healthcare system, but I think it would have been something that I would have enjoyed doing because there were elements that probably could have been improved in my case, and I think it's really important that we capture that data so we can constantly strive to be the best we can be in this space.
For evaluation and for the effective management of a program, data is essential. Data, or more correctly, objective, systematically collected information, is a vital tool because it creates knowledge, and we can therefore make decisions, choices, and management of a program based on objective knowledge, not supposition, not what we think is happening, but what is actually happening. Zero suicide in healthcare is a program that is intended to bring about change and improvement. So a baseline of data, or in other words, a current picture of what is happening, is essential for you to be able to measure the change and improvement that you're making. But a key feature of effective evaluation, particularly in the context of continuous improvement, such as zero suicide in healthcare, is the democratisation of the data and knowledge. Those data sets that are collected need to be available to people in an environment that is non-threatening, not blame-oriented, but more inquisitive and seeking to solve problems. And then that data and knowledge can be a powerful force for continual improvement because it helps understand where things went wrong, where things could be improved, where something didn't work as intended and can be changed. In zero suicide in healthcare, there are a number of key things to measure. Pay attention, for example, to where there are incomplete uses of tools such as assessments or safety plans. Pay attention to some of the variations around where patients are presenting and who and how they are responded to. So process indicators are really important. But it doesn't finish there. You're also looking at results and outcomes. So in zero suicide in healthcare, our focus is primarily to provide improved care, more compassionate, more responsive, more evidence-based care for suicidal people and their carers. So the process tools we're using are our means to that end. But we certainly want to use measures in evaluation that check if the ends or the results intended have occurred. Satisfaction surveys from patients. Feedback. What was their experience? Were the health professionals and workers compassionate and respectful as you wished?
If we're surveying the exit of patients from programs, I think that's probably the best way to capture that. It is difficult for patients to speak on their mental health experience through the healthcare system when they've just gone through it, I think. So maybe there's a time lag with follow-up, I'm not sure, but it's certainly the best way to improve our care and touch points for patients in mental health crisis.
So for instance, safety planning is one of the key tools being used. Measures need to be introduced to check that every person is offered and engaged around safety planning and that the safety plans are formulated within the format required and are actually used. Were they and their carers better equipped to deal with a suicidal state in the future? Were they referred to other services and supports, including related health services and therapies, that would help them better manage and understand their suicidality? And ultimately, did those people who survived a suicidal crisis and came into care experience a reduction and de-escalation in their suicidality? It starts with people who need better care and support, and it ends with people who we want to support in their recovery and their lives. So the data that is collected must include data that is obtained from the people who are receiving the services and care through the health system.
I think it's a necessity that lived experience is a part of the process. I find it really powerful when I hear people talk from a lived experience that have a bit of expertise as well, or have someone with them to talk from that expertise angle. It works really well. It's like a perfect partnership. You need both sides.
The usefulness of the evaluation comes back to lining up the data collected against those questions and forming judgments or findings in answer to them. Well, the Zero Suicide in Healthcare initiative is all about creating change. And one of the things that it's seeking to change is the culture and approach of the healthcare systems towards suicidal people and their carers. So evaluation is really important to supporting culture change because it provides the means and the frameworks through which information and knowledge can be harnessed and used for continual improvement. So for those in leadership roles with Zero Suicide in Healthcare, evaluation is one of the things that you can use to advance the culture change.